Good evening, everyone. Myself, ARSHDEEP Singh, Assistant Professor, Meera Medical Institute of Nursing at Hospital Abohar. So, today I am continuing with the second part of the topic that was records and reports. So, first part I have explained in the previous lecture. So, let's start with the next topic that would be the records and reports part 2. Okay. So, that is the content as you all can see on your screens. In the last topic, I have completed up to the various types of records. Okay. Next, here are some of the guidelines or the principles relating to the record writing. Okay. So when we are writing a record, so there must be some of the things that or the principles that have to be kept in mind. Like uh, we can say, yes. So we can say some of the things. Yeah. So here are some of the principles related to the record writing. So first of all is that does the record focus on the family and the community as the object of the care? So it is obvious that when we are recording something, so we should be having the complete knowledge about that patient or the person and the family members or the community. So the purpose for what we are taking this record, so we have to be kept in mind. So it must be focused on the family and the community. Second, does the record present the problems? So that also might be the I can say that the various types of problems must be listed on that. Next, are the goals explicitly defined? So, what are the goals for maintaining that type of record? So, are we able to achieve the those type of goals? So, we have to state it or define it clearly. Is the action plan stated clearly? And next point is, are family responses to the problem and the nursing action taken clearly identifiable? So basically, these guidelines are about that if we are maintaining a record, so we have to get in touch with each and every point of the patient, the community, or the individual for which we are maintaining the record. Either it is a single person, either it is a family, or either it is a whole community. So we have to follow these types of principles. Next, some of more principles are like with these aims, community health nurse should has to follow certain principles of the records. Like nurses should develop their own method of expression. So it must be understandable to the nurses, or they should develop their own method of expression that should be easy and comfortable to the nurses for the maintenance of the records. Next, records should be written clearly. They should be mentioned clearly, appropriately, and legibly. There should not be any type of mistake while maintaining a record. Next, records should contain facts based on observation, conversation, and action. So, these are some of the things like uh, uh, we can say that the information that we are going to write in the record, so it should be having some factual data or might be based on the genuine facts, or the information it is containing must be based on the proper observation, conversation, and action. Okay. Next is a select relevant factors, and the recording should be brief and accurate. So we have to write briefly about each and everything and in an accurate manner, so that we should be having the record that will give us a complete and the accurate information. Next, record should be neat, complete, and uniform. It is obvious that while we are maintaining something like the record, the report, so it should be neat, clear, clean, complete. It should not be like that something is written or something is not written, and it should be in the sequential manner. That is, uniformity must be maintained. Next, records are valuable legal documents, and so they should be handled carefully and accounted for. So uh, I can say that only the a person specified for the maintenance of the record should be get in touch with, or they should be allowed to open the records, or they can only check the records. Likewise, no other unauthorized person should be having the access to these type of records. Next, record systems are essential for efficiency and uniformity of the services. So records also gives us a evaluation of the what type of services are we providing. And we can rate our services because based on the records available. And record should provide for the periodic summary to determine progress and to make future plans. So it can also give us a clue that what can be the future plans for the specific hospital or the institution, what are the various deficiencies we have to change. Okay, and last, use universal terms to record the information. So there should be the use of the universal term that must be equally understandable to each and every member of the health team. Okay, so that was some about the some of the principles. So these are some of the principles that we have to maintain while maintaining the records. Next are the record filing and the maintenance. So some of the guidelines are written here that records can be kept in many ways. It is essential to have proper and systematic filling of the records. So time and efforts are saved. So to save the time and effort and for the uniformity of the record, we have to maintain it in a sequential manner. Okay. So like the some of the major methods of the filling the records are the alphabetically, we can write the records in an alphabetic manner. Second is the numerically, like the 1 to 3 or any other type. Geographically, they can be arranged like the district wise, area wise, like the district wise or the village wise or the city wise, and with index cards. Okay, so these are some of the ways like we can manage or maintain the records. Okay, next are the guidelines for the preparation of the records. So how can we prepare the records? What are the basic we can say that the guidelines that while we have to, when we are going to maintain the records or preparing the records, we have to keep in mind. First of all, the records should be clear, appropriate, legible, and accurate. Some of the guidelines will be equivalent to the some of the principles. Okay, so it should be clear, appropriate, legible, and accurate. Second thing is should be real and based on fact. So I have already explained this because a record will be having no meaning if it is not based on some of the facts or it is not giving the factual information. Okay. Third, abbreviations and short forms can be used in the records, but these short forms should be generally acceptable or universal. Okay, so abbreviations, we have to use the abbreviations and short forms, but these short forms should be generally acceptable or universal. We should not use any of the abbreviation that is not universal or that is not professional. Okay, so we should only use, the nurses should only use those types of the abbreviation that everybody will know and will be familiar to that term. Okay. Next, sentences used in the record should be short and clear. We don't have to write each and everything. We have to write each and everything, but not in so much detail. We are maintaining a record. Okay. Next, paying special attention to numbers and statistics is essential. And record should be written in chronological and orderly manner. It should be like the in a sequential manner, first, second, third, and fourth, and based on the priority. Okay. Next, record should be written immediately following an act or interval. Okay, so it should be based on the like why while we have observed something, or it should be based on that data. Next, uniformity in writing records should be maintained. Okay, so it is not like that we are maintaining the record, but there is a time interval between the maintenance of the records. After a time period, we are again maintaining. So there should be the continuity in maintaining of the records. Next, take care not to make errors in recording, and if anything is crossed out, it should be dated and signed. Okay, so we have to avoid making any type of errors because it will lead to the we can say that the that type of record will not be acceptable if it is containing many of the errors. Okay, next, record should provide for the periodic summary to determine progress and to make future plans. So what will be the future plans? Okay, and the what would be the uh, uh, it will provide the total summary that what type of the status was the uh, patient or the family or the community was affected with, or what type of care is provided by that specific community health and primary health center or any other type of center. Okay, and next, it is necessary for the person filling the records should sign the record with date and time. So that person would be accountable for the maintenance of that type of record and that type of the specific care that is provided to the that type of individual, family, and community. Next, records are legal documents and should contain true facts. Okay, so records should be attached with the legal documents so that it would again provide the genuinity to that type of record, and records should be confidential and should be available only to the care providers. It should not be handed over to any of the person who is a non-professional or is a non-healthcare provider. Last one, records should be stored safely and protected from moisture and termites. So to prevent it from the damage, we have to maintain this. Okay, so that was all about the topic of records. Okay, so I have explained you about the introduction, that what is the definition of the record, what are the various types, and what are the methods we have to use, and what are the principles in the maintenance of the records. Next and second and last topic is the reports. What are the reports? So while I was explaining you about the records, records were mainly in the written form, but reports can also be in the oral form. Okay, a report offers summary of the activities and services of the nurses and other healthcare workers. Report like record should be filled in such a manner that community health nurse gets the correct and appropriate report timely. Okay, so what a report offers is it provides the likewise the record is providing us with the various types of summaries of the activities and the types of services, but the main difference is that it can be in either in the written form or in the oral form. Okay, so next is the purposes of the reports. What are the various purposes of the reports? So first of all is that to show the kind and amount of service rendered over a specific period. Okay, so first purpose is to show the kind and amount of service. So that's why we are maintaining the reports. Second is to illustrate the progress in reaching goals. For example, like we are reporting each and everything like this procedure is done, this has to be done, this was done on this time. So we have to report it to us, our senior. Okay, so we check or illustrate for the progress in reaching goals. And next is the as an aid in studying health conditions, it is beneficial for the healthcare members to get knowledge of the information about the various types of health conditions. And next is as an aid in planning. We can plan from the various types of reports, like what has to be done to increase the output of that institution. And last one, to interpret the services to the public and to the other interested agencies. What type of care is being provided, what was provided, and what can be provided. We can interpret it to the general public. Okay. Next is the filing and maintenance of the reports. How can we file and maintain the various types of reports? So there are different points. These points are like I have explained in the records. Reports can be filed on the basis of the group of the houses, lanes, and villages. So we can report and manage or maintain them according to the number of houses, according to the lane, and according to the different type of villages. Next, reports can be prepared at the time of completion of the work. The report can be prepared on the daily, monthly, quarterly, or annual basis. When we have provided the care, then we write a report. While we are working, we only maintain the record. But after the providence of the care, we check or evaluate our work, and then we we can say that evaluate our work and then write a report that this thing was done and this is the evaluation. So mainly or basically the report is for the purpose for the report is to get an evaluation that what has uh, done to the patient or the individual or the family or the community, and what are the basic outputs. Okay, next, so it can be maintained on the daily, monthly, quarterly, or annual basis. Next, this can be filed according to the name of those who started the work on first letter of the activity. And reports can be expressed or filed according to the numbers or in a serial order like 1, 2, 3, 4. So we can give number to each report, like 1, number 2, number 3, number 4 number. Okay, so these are some of the points for maintaining or filling. How can we fill and maintain the reports? Next are the guidelines for the preparation of reports. What are the various guidelines? How can we manage the reports? So a general method or outline of the writing the report should be prepared before actually writing the report. Okay, so we have to make outline at what has to be written on the report. And second, as far as possible, printed form should be used for the writing the report. So sorry, so we have to maintain uh, a report, like we have to use the various type of printed forms so that it should be easy or beneficial to understand that report. Next, it is necessary to collect all the information and material to make the report complete. So we have to get in touch with each and every information and the factual data that we need to provide the care. Next, style of report writing should be easy to understand. So style of report, like we have to maintain a sequence, uniformity, neatness and cleanliness. So all of these things should be present in the report. Next, report should be arranged in a manner that the essential information can be retrieved easily. We can give the priority to the essential information. I'm not saying that we have just to write only the important information. We have to write each and every information, but we have to manage the information in the way like it should be easy to retrieve the information from that report. Okay, like the important point must be underlined or highlighted. Okay, next, presentation of the report should be attractive and important points should be stressed and underlined. So that is the point exactly I was talking about. Next, important information should be written or expressed in specific manner. And reports should be comprehensive, factual, and based on the supervision and actual information. So this is the point that is going to be repeated over and over time. Next, report should be, the wording vocabulary of the report should be simple and correct. Sentence making, use of the vocab or other types of words. Uh, these should be used in a manner that the sentence making should be good and meaning should be clear. So these are some of the guidelines for the preparation of the reports. Okay. Next are the list of the monthly reports. What are the types of monthly reports that we are having? Okay. So first is form number 1. Okay. So it includes sub-center action plan. So list of the monthly reports, like we are maintaining. These are some of the examples of the reports that we are maintaining. Like form number 1, sub-center action plan report. Form number 4, A&M monthly activity report, the health worker female report, and form number 6, monthly report for the health worker male. So these are the examples of the report that are being used under the sub-center. Okay. Next are the types of reports. So what are the basic types of reports that are present? So it is of two types. First is the verbal. It is sometimes used in emergency and followed by written report later. Like in the emergency, we are just providing the care and not writing anything. After that, when we have done the procedure, we write a report that this was the condition of the patient and we have provided this care. So after the providence of the care or when the situation of the patient is maintained, we are writing a report. So that is a verbal report that we just only conveyed the message in the verbal way. Okay. And second is written. Obviously, it is in a written form. So next is a complete and detailed report holds an important place in the health management. 24 hours report, night and day report, these should be maintained. And supervised report, patient census report, accident report, financial report, etc. So these are some of the examples of the reports that are have to be maintained or are maintained in the subcenter PSC or CSC, because these are the reports by which we can check ourselves, check the condition of the patient. We know about the condition of the patient, the status of the patient. Okay, so these are the types of report that are maintained in the different types of centers. Okay, next are what are the essential requirements of records and reports. So what are the basic requirements? So yeah, what are the basic requirements for the records and reports. So while maintaining, what we require actually in the records and reports is are valuable documents. So these are valuable documents. They should be carefully handled, carefully filed, and always accounted for and kept them in at a clean place. So these are some of the basic or the simple points. They should be protected against mites and insects, and good filing system should be adopted. Likewise, the person who is managing that type of record and report must be clear and obvious that how to maintain the records and reports. Like we want to get the information on the record of a specific patient, so it might be easy to get the information from the file. Like they must be given the sequential number or the alphabetic order or the geographically these records must be maintained so that we can easily get the benefit, easily get that record. Next is these should be easily available on time, and confidential record and report should be shown only to the authorized person. Okay, and they should be complete in detail. So these should be written in a detailed manner, and they should be written in such way that the minimum of the clerical work is involved. Okay, so these were the some of the essential requirements. Okay, next are the design of cards or the records. So what are the types of what can be the designing of the cards or records, like various types of the formats we can use to maintain the records. First is the folder type. It is a broad card which can be folded into many parts, say 8 or 10 pages. Some pages may be blank for the future. Likewise, the community health nurse is using the folders. So that is the example of the record. Like we maintain a single folder for a single family. Okay. Second is the file type. For each page and its file is maintained. The outer cover of the file is usually printed with columns for summarizing information, and the periodical letter are entered in separate leaves of the papers and inserted in the file. So, a detailed information, or the we can say the information is written on the front page of the file, and all the information of the documents are attached in that file. So that is the file type. Next is the envelope type. The file type, when closed on three sides and kept open on one, will form an envelope. Okay, and that data are entered on separate leaves, tagged together and inserted into the envelope. So we are using an envelope to keep the record available. Okay, so that was about the design of the cards and records. Next, role of a community health nurse in securing record information. So that is a point of the topic subtopic under the records and reports. What is the community health nurse role in securing? So these are some of the simple points. Like records may be initiated in the center or home. When getting information for record, the nurse and the individual should be seated comfortably in a private and a quiet area so that the information collected may be kept confidential and at a professional level. So it is obvious that the community health nurse will conduct an interview and will get each and every data related to the patient, the family, or the community. So each and every data should be or must be taken by the community health nurse, and do not stress for getting economical and social information. So if the patient or the person is willing to give the information, then only we should write that on the record. Otherwise, if the family member of the person, the patient, is having problem in giving that type of economical and social information, like many of the persons can would hesitate to provide this type of information. So we don't stress them to provide that information. Okay. Next is cooperation of the individual and the family in making records is important, and explain the reason and the confidential nature of the records. So many of the person may hesitate to give you about the information. So firstly, get a confidence level, okay, and introduce yourself and maintain a nursing process, and then uh, motivate them to cooperate, and then get the factual data. Okay, so that was about the nurses role, some of the points. Next are the last topic, subtopic in the today's lecture is uses and importance of records and reports. What are the various uses and of the records and reports? So I have already told you about this. So let's get a brief summary of this. Records provide basic facts of for the services. So the basic type of the services that we have provided to the patient. So records always provide this type of information. Next, they provide help to collect the data from the community in a systematic and ordered manner. So it is a method in which we can get the information from the community and write them in a sequential manner, and we can make the policies of the programs for the community. Next, records and reports assist in assessing the health level of the community and family. So it is obvious that when we record maintain a record and report, we can easily get the or assess the information, and we can help the community at their level best. Okay, and they help the nurse to organize her work in an orderly way and to make an effective use of time. So it prevents the duplication of the work. Like for example, a nurse is providing the care in the primary health center or the community health center. He or she is giving an injection to a patient who is admitted to the CSC. So uh, he or she has given an injection that must be on record, because it might be difficult to we can say that remember that injection was given to the patient or not, but the record will tell you about that this was given or not, and it will prevent the duplication of that administration of the medication. Okay, so that would be very beneficial. Next is they provide a basis for the short and long term planning. So we have to plan, we can make use of the records and reports. Next, they assist in determining the needs of the resources. We are having a shortage of the medicines, equipment, and supplies. We also maintain the records and reports about the inventory that is available in the sub-center PSC or CSC. So these are records and reports only that would tell us that we are having a shortage of the medicine, equipment, and supplies, and we have to borrow that for the providers of the care. And next, they about duplication of the services. Likewise, I told you. And last point, they work as a tool medium of providing health education to individual, family, and community. So we can assess the records and reports, and we can get a knowledge that are the persons who are living in that specific community are educated or aware about the various types of health conditions. So if the incidence of the prevalence is very high, likewise they will told us it will told us or gives will give us information that there is a need of the health education, so we will follow that. Okay, so that is all about the uses and importance of records and reports, and that was all about the today's lecture. That was records and reports part 2. So in today's lecture I have explained you about the what are the various guidelines and principles of the records, and how we can maintain them, and a complete information about the reports. What are reports? What are the types? How can we manage them, maintain them, fill them, and what is the nurses tool, and what are the uses of records and reports. So that was all about the today's topic. So I will uh, next time I will start with a new lecture in next week. We will meet in the next week. So I'm thinking to start the new topic of the diseases. I will try to start the explanation of the my next lectures will be on the various types of diseases like the AIDS, cancer, either the communicable or the non-communicable ones. So I suggest you to subscribe this channel, my individual channel that is on my name, that is ARSHDEEP Singh, and our college official YouTube channel, that is Mira College of Nursing. So you can also subscribe to that, and also we are available on our Facebook page. Okay, so you can also get in touch with that. Okay, so thank you everyone. I will meet you next week. Thanks for that. Okay, thank you.